Understanding snoring, causes, risks, and remedies. Snoring is more than just noisy breathing during sleep. It can significantly impact health and well-being. By understanding its causes, symptoms, and treatments, individuals can take proactive steps toward better health and quality sleep. Snoring happens when the airway becomes partially blocked during sleep. Key causes include poor muscle tone in the throat and tongue, bulky throat tissue or a long soft palate, nasal congestion caused by allergies, colds, or sinus infections, structural issues like a deviated septum or nasal polyps. Snoring isn't just about noise, it can indicate serious health issues like sleep apnea. Risk factors include being overweight, middle-aged or older, or a postmenopausal woman. Common symptoms are loud snoring paired with breathing pauses, excessive daytime sleepiness and morning headaches, sore throat upon waking and loss of concentration, persistent high blood pressure. Such signs shouldn't be ignored, as they are often tied to larger health concerns. If you snore, a healthcare provider may evaluate your airways via a physical exam or imaging tests like a CT scan or X-ray. A sleep study, polysomnography, may also be recommended to monitor heart rate, breathing, and sleep patterns. Simple steps can improve sleep, such as avoiding alcohol and sedatives before bed, using nasal strips or elevating your head while sleeping, sleeping on your side or using a specialized pillow. Take snoring seriously. It could be the key to improving your overall health and well-being.